Oh yeah. Now we get to count
Hello.
down again.
Hi, peoples. So it's been a minute. I've missed all of you. I'm sure that you've been thinking, why doesn't she make more videos? Which is a long story involving a scooter, a brand name not to be revealed on this, and a lot of dental work.
That looks so good now.
Thanks. It's still not done, but it's cool. So I am super excited to introduce you to our new clinical recruiter, Kasey. Woo!
Thank you.
It's very exciting.
It is. I love being here.
Yay! I love having you here.
Thanks.
We're gonna have like a total party here, like geeking out. It's cool. We even dress alike.
We're matching. We're matching.
So you might be confused because our name is Pathway, but Forefront is our holding company. And so we have matching Forefront jackets. It's pretty sweet. Did you like that?
I do.
Like that? Awesome. We're very serious about our work here. Very serious. So I thought that it would be fun if we kicked off the first video of 2019 with some questions about Kasey.
All right.
Yay!
Shoot
So
'em away.
let's start with, how would you describe your role here at Pathway?
I am recruiting. I am calling all of these nurses that are looking for new positions. I'm trying to find the best position for these nurses, for these clinical professionals, for these medical professionals. So many nurses have so much different experience, and I'm just kind of looking to find the best position in terms of hours, shift, location, position, what works best for your personal life, what works best for your professional life. So I'm loving getting to meet all these new nurses and other medical professionals, and I'm also learning a lot about different medical fields, because I've only worked in nursing, and now I'm getting to do a lot with other medical professionals, and it's really cool.
It is really cool. So let's talk a little bit about talking to all these people. What's your favorite part of having these conversations with nurses and, let's see, vascular techs, ultrasound techs,
respiratory
therapists. We had occupational therapy the other day.
Physical therapy.
What?
Medical assistants, did we already say that?
I don't remember. Let's say we didn't. Okay. But let's say you do spend a lot of your day on the phone.
I do.
Yeah.
I love healthcare professionals. I think we're all kind of like, it's its own beast.
Yes.
We all, like, once you're on the inside, you have a different understanding and like different view of healthcare, and it seems like we all have the same like struggles and needs. A lot of us have busy personal lives, kids. Just hearing past experiences in this field, I can relate to so many of their like experiences and their concerns and what they're looking for. I really like talking about their experience, their professional experience, and talking about, interaction with patients, because that's what we do, is we interact with patients. And everybody that I've talked to seems to have at least one pretty cool story, which we all have a million stories.
I bet. So one of the questions that we usually ask our applicants in the nursing profession is, what is your nursing superpower?
Wounds. Wound care. I love a nasty wound.
This is like the only safe place to say that.
Healing it.
Healing it, yes. What do you like about it?
It definitely gives you something to look at and see your progress. If you're off work for a day and you come back and see it again, you can see the healing process, and it's very cool to know that you did that, I did that, I healed that wound.
That's true. That is very true.
And some of the technology with wound care is fascinating. Wound vacs fascinate me. They're a lot of work.
Mm-hmm.
A lot of work.
They are.
But once it's a skill, like it's an art, it's a skill. Once you have like a wound vac, like once you have that skill mastered, it's not scary anymore, but it is I actually like teaching people how to do wound vacs.
I love that about you.
Yeah. I'm like, let me show you how to do this.
Yes. Yes. I will share with you that anyone's that come through our doors, which as you can imagine in an office with nurses, the non-clinical people frequently have questions, right? This is the thing we do. But if any of our coworkers come in with a wound, you are in charge. I want nothing to do with that one.
Done.
It's not my bag.
I'll take it.
Fun times.
Yeah.
I will say everyone has their yuck, right? And I will say I would rather have a wound than a trach.
Yeah, that's a rough one. But we've got we're also hiring respiratory therapists.
What's that you say? Respiratory therapists. Yes.
So that's all they do, and they're usually very good at it. And we thank them.
Thank you
for doing that job all the time.
Oh my gosh, it's crazy because I hate to say this, but I feel like, as we all know, healthcare is a team sport, and you have to have members from all the pieces of the team in place in order to provide the very best patient care. And that is what I want every single time. And also, if I had to be the respiratory therapist, it would be a very short day.
Yep, part-time.
Yes. And goodbye.
Per diem.
Yes. I feel like we're our own talk
limits.
show. We do. We have our own limits. So, one of the things that I often get asked by applicants who are applying for jobs with us is what makes us different, or who are we, or what is it that we do? How do you answer that question, Kasey?
Well, we're nurse founded. You, Kyle, both nurses, both with history on the floor. So like started from the bottom, now we here.
I feel like this is the greatest achievement of my professional life, that I hired someone who just dropped that line in the middle of our Facebook Live chat. Yes.
Well, you get it. We get it. Everyone here understands like the needs, the support that we want, that we very rarely get from an employer.
Yes.
We do offer benefits, which for a staffing agency is not the standard. And they start from day one. So you're immediately insured the day you start. And then like we're here to be your like your support if you need something, but we're also here to be your defense. If something is not going right, that's where we can intervene between you and the boss, or between you and your job. So I think that's really cool that it's like just a second. I don't know how to say it. We're amazing.
Kasey is amazing, for sure. Let the record reflect. But I think that, correct me if I'm wrong, but one of the things that Kyle and I feel passionately about is helping our helpers and being able to say, what are the tools that you need to really give what you need to give to your patients today? And sometimes that is tuition assistance, and sometimes that is health insurance, and sometimes that is I need to be able to call you and say, oh my God, the day I just had, which don't call Kasey at night unless it's super important, please. But
I'll probably still answer.
She'll probably still.
We can chat.
We can.
Yeah.
That we are interested in supporting and having relationships with the people that we place, so that you not only have the support of your coworkers who are on the floor with you, but you have clinical people at home who understand what's going on and can help you talk through some challenges or clinical situations that maybe we've encountered.
Yeah, I want to make sure, because you don't want to, there are times you need to vent. And yes, venting at work is generally frowned upon. It leaves a bad taste in people's mouths, but like I'm happy to take the venting. I'm happy to help. Whatever it is that you need, I will do my absolute best to get you that help. We have done some extra things for new hires just to make the process easier, just to make the transition process smoother. We've done some extra things that no employers I've ever worked for would have done. So
it's true. It's true. So one of the reasons that Kasey is such a fantastic addition to our team, and there are others, and I will introduce them to you on other days. Yeah. But one of the things that I, from the very beginning, loved about Kasey is what a strong advocate she is for her patients, and then also for puppies. Kasey does animal rescue. Is that the right word? That's the right word.
Animal welfare.
Yes. And the organization that you work with is called Helping Paws.
Helping Paws, Inc. Adoptable Animals. There's a couple different branches to it. We do fostering and rescue through high kill shelters, and fundraising for other rescues. I've fostered, I think, like 10 puppies last year for them. And then we do a lot of just helping with medical bills for people that can't afford something. I mean, with animals, there's never like, you can never do enough. It's such a sad problem in the world these days. So we've done so many medical cases between, running to animal control to get a sick or injured dog and just take it to the vet for immediate treatment. We'll figure out what to do with it later. But right now, this dog got hit by a car. Some of the puppies that I fostered came from puppy mill situations, or what else have I fostered? Like mom didn't survive, the birth. Yeah. So I love all things animals. I've been a caregiver my whole life.
That's true.
I feel like kids and animals.
Well, that's
and
exactly right.
I also work part-time at an animal hospital. I've been there since I was 14. And I have like my own zoo at home.
You do have your own zoo at home.
Yeah.
Awesome. All right. Well, I don't want to make this too difficult for you for your first time. You doing okay?
Yeah.
You feel good?
Yeah. Sweating.
So much pressure.
But you can't tell.
You can't. It's good. So I know we have some of our other staff members out there. Do you guys have questions or things that you think that we should share with our friends?
They're watching.
They are watching. We see them, and sometimes they like us and love us, and it's very good. We're huge fans. Awesome. So, of course, we will take this video and shoot it out to everyone in a link that we can share, so that if you have had a really good experience talking to Kasey on the phone, or there's a job that is out there that has kind of piqued your interest and you've been wondering if it might be worth submitting your stuff, Kasey will be the one who takes a look at it and gives you a call. So give us a like on this video, as what they say, share and subscribe.
No,
you don't have to subscribe, but this is a different thing. But we are here.
Like, share, and comment.
Yes, that's the one. So like, share, and comment. And we have a bunch of new posts up lately. Are there any that you want to call out specifically?
For jobs, we are really looking for kind of up north near the Chicago area. We've got a lot of jobs available up there, a whole bunch of different Specialties, yeah.
Yes.
Drew a blank. So if you know people,
it's okay. It's all right. I got you.
So if you know people up near the Chicago area or northern Indiana, share with them, tag them. We do offer some pretty good stuff. So
yeah,
and we want you on our team.
We want you on our team.
Come
I feel
join.
like we should do something. On that note, friends, I don't think we can get any better than that. That was the ultimate. Like, first there was Drake and then there was dancing. So it's all good. So we see you. We appreciate you. We believe in the work that you're doing. And we would like to help you with that if you want to give us a call. All right.
And if we do another Facebook Live video, I might have a different color of hair.
It probably will be a different color. So much suspense. Tune in next time
for my hair color.